I'm in the home and garden decor business, and I travel like several states. I live here in Birmingham. 3 years ago, I was out of town on business, and I noticed I had a little blood in my urine. I called my internist. He recommended I come back in to see him, and as I got close to town, I called him. He said, "Why don't you just go over and see UCA?" And I said, "Okay." So I went to the office at St. Vincent's, and Dr. Holley was the doctor there, and I saw him, and he did a scope, and he told me that I had bladder cancer. I did used to smoke many years ago, and I did not realize that there were a correlation between smoking and bladder cancer. But it has been proven that there is a correlation between smoking and bladder cancer. So I would urge anyone that is smoking today to please quit. Surgery was done at St. Vincent's. This was done robotically. The doctor came out, Dr. Holley, and said that, told my wife that he thought he got everything, and it was okay. It looked like it was a tumor in my bladder, and he thought he had gotten everything. When the path report came back, it showed that there could be a few other cells, so we had to go back in there and re-scrape, and this time it came back negative, which I was very, very pleased. And I would say Dr. Holley was fabulous. I mean, just one of the most caring doctors I've ever been around. This was done 3 years ago. I'm doing great. Well, I'm able to do everything that I used to do. It has not restricted me at all. I was able to return to normal activity about 6 weeks after the surgery. Actually, I started, I wasn't completely laid up. I was doing some things a couple of weeks after, but back to normal activities about 6 weeks. And I've had, I felt fine, had no problem. The only problem was the chemo that I had during the period. I had 6 weeks of chemo, and that toward the end of the 6 weeks you start feeling a little weak. But other than that, I had no other after effects, and feel good today. I think it's very important that your family be involved in this. When the day that Dr. Holley told me that I had bladder cancer, my wife came down and met me at the hospital, and she went with me to the MRI because we went immediately from his office to have the MRI, and she met me. And every doctor visit, my wife has gone with me because she likes to laugh and say that I hear about half of what the doctor said. And she would go and she would take notes, and then when we would get out in the car and get home, I would say, "Well, he said this." She said, "No, he didn't say that. This is what he really said," you know. So I think it's really, really important, because most people, if they're like me, the minute he told me that I had cancer, I went like blank. And I was asking questions, but I wasn't remembering what I was asking, and I certainly didn't remember all the answers. My diet has changed considerably. I try to watch what I eat. I try to eat more vegetables, less, for a lot of reasons, because I don't want to gain so much weight. But I am trying to eat better foods. I do exercise some. I used to exercise a lot. I used to run about 2 or 3 miles every day, and because of my job, I have to travel so much. I don't get to do that quite as much, but I do it on the treadmill at home. So exercise is really important. I will say this. I used to think, hear people that had cancer, and I would say, "Oh gosh, I feel sorry for them. I hate that, But when I had this, it really brought it home. And one positive thing out of this is that I was able to start a cancer support group at my church, which has just been fabulous. More people, I've had so many people come up and say it has been a blessing to them. We've had physicians of all kinds. Dr. Holley has spoke. We've had other physicians that have spoke to us. So it's been a blessing. So through my cancer, we were able to start a cancer support group at our church, and it's nothing that I've done. I want to stress that it's all of what God has done to His glory. So it's all part of bringing honor and glory to Him. But it has been a blessing to so many people.